In this video, I want to show you 3 pelvis movements that you need to be able to do in order to avoid lower back pain and potentially treat it as well. Now, these exercises that we do on and off through all 4 phases of my Not Really Yoga system, and you can follow along and have a go. The first one is an anterior and posterior tilt of the pelvis. Now, essentially, this is what we will call a sagittal plane movement. And I mention this because all of these movements are one plane movements. That means that your anterior tilt shouldn't be accompanied with a transverse plane motion, which is a rotation. It should be strictly front and back. Ideally, we also want to see some movement in the feet as we do come to rotate through the pelvis in this fashion. So I'll just briefly go through these because I'll have some other stuff to follow up with this later on as well. Next one is a transverse plane motion where we're going to isolate the rib cage and see if we can only rotate through the pelvis. Now, this should also come with some pronation and supination of the feet, which ideally also has you maintaining big toe contact. So again, whilst you will have some accompanied slight change in anterior and posterior tilt of the pelvis, it shouldn't be something where you're translating your weight too far back as a result of the rotation. It should be as much as possible a transverse plane motion. This one is our frontal plane motion, which is a hip hike and a hip drop. And so in this, we're going to bend a knee and keep the other leg straight. Some people have a bit of trouble with this, and I find teaching this can sometimes be helpful on the side of a step where you're just going to keep a straight leg and hike the hip. But as I've said, these are all things that we want to be able to do in order to avoid lower back pain or potentially treat it. Now, on that note, I'm not saying that doing these 3 things is necessarily going to treat your back pain, but what we do need to understand is that as we start to get tightness through our back, we tend to avoid some of these motions. When we avoid these motions, then the muscles that attach to our pelvis, between our pelvis and our rib cage particularly, don't get to contract and relax. And it's not just these muscles when we think about it as well. Like if we look at the transverse plane of motion where we're rotating the pelvis, if we can't rotate our pelvis in this fashion, that means that the leg I'm rotating towards doesn't get to experience internal rotation. This is something that often people present in my clinic here missing. They tend to miss the ability to internally rotate their hip. So by missing these motions, we're also losing the opportunity for muscles that respond to these joint actions to contract and relax. So if you can't do these, and it's quite likely if you're watching this and you have a lower back pain, you probably have trouble doing one of these because you've probably set up a bit of a strategy to avoid those things that do exacerbate pain. So in that case, we need to chase what that is, and we would need to treat that accordingly. Just doing this motion probably isn't going to be great for you. Having said that, trying to do this in as much of a pain-free range of motion is probably helpful. But if you're looking to avoid lower back pain, then these are the things that you need to do. So, whilst they all look pretty funky, they're certainly a good thing for you to work on. I'll do some follow-up on things that we can do in order to chase these positions if you can't find them. If you want to see them, make sure you comment, like, subscribe, share. I think they're all the things you need to do, and I'll see you next time.